From the Einstein Healthcare Network studios in Philadelphia, this is Health and Wellness.
Hello everyone, I'm Genaye Channel with my co-host Dr. Lawrence Brent, a rheumatologist with Einstein Healthcare Network, and this is the Rheumatology Show. Our topic is lupus. So Dr. Brent, let's get right to the questions that stem from our viewers. What exactly is lupus?
Well, lupus is a disease that we see fairly frequently, and it involves the immune system. And actually, the best description I ever had was by a patient who said, it's like my body is allergic to itself. So what happens with these patients, their immune system is overactive, and it's actually attacking their own tissues. And we can see this by the skin rashes, the joint involvement, but also by lab tests, which have what we call autoantibodies, which are antibodies, instead of being directed against a virus or an infection, is actually directed against your own tissues.
So how is lupus typically diagnosed?
Lupus can be very easy to diagnose, but it can be very tricky. If you have a patient who comes in with the classic skin rash and joint involvement and has the blood test to go along with it, it can be fairly easy. But patients can present with weight loss, fever, fatigue, maybe some mild blood abnormalities. So sometimes in these cases, you have to dig a little deeper, take a better history, examine the patient carefully, maybe for a little bald patch, not like my hair, but a patient's hair, a little bald patch, and then use the lab test to help support a diagnosis. So it's almost like uncovering clues. You need a number of clues to come together to make a diagnosis of lupus.
And how is lupus typically treated after it's diagnosed?
It depends on the patient. So I do have some patients who have very mild disease that are actually on no medication at all, or they take a little over-the-counter, anti-inflammatory agent or acetaminophen, for an occasional joint ache. But most patients that we see are going to be on a medicine we call Plaquenil, which has been around for decades, but it still works really well and it's very safe. And it helps patients particularly that have skin rashes, joint pains, or fatigue, or certain other features. A lot of patients do, though, require steroids, and often we use prednisone. And the drug works wonderfully, but it's the side effects over, if you're taking it for a long period of time, that's a problem. And then if those medicines aren't working or aren't enough, then we go into a whole bunch of medicines that might actually help to kind of tone down this immune system, and it really depends on the patient which medication we would actually use.
So do women only develop lupus? Can men also develop lupus?
Well, lupus is a disease that's much more commonly found in females. It's classically described as a disease of women of reproductive age, so age 15 to 40 or so, but we do see it in children and in older patients and even in men.
What are some symptoms that a person may exhibit that may need to be looked at as far as lupus is concerned in their body?
Well, the real typical ones and the most common ones are certain skin rashes, and some of them are very, very common in lupus, and you don't see them in other diseases often. And the other thing is arthritis. And so they'll get skin rashes, particularly across the bridge of their nose, sometimes on their forehead. And when you have this involvement, it's sometimes called the butterfly rash. And the butterfly is a symbol of like conferences that deal with lupus and the Lupus Foundation because of this rash. They can also get loss of hair, so the hair just comes out in patches or sometimes all over. And in a young woman, that's not from normal balding. Right. And the other thing is the arthritis, which often involves the hands, the wrists, and the knees. And you'll see swelling, and they'll be stiff. So those are the most common things that we see. But anything like being tired, losing weight, being depressed, sometimes sores in the mouth, there's a whole bunch of different features that can be present in a patient that for a physician can be a useful clue.
And what should the patient public know out there regarding lupus?
Well, one thing is that if they feel that something's going on, particularly if they have a family history, like a close relative in their like parent or brother, sister, even first cousin, that these things do run in families, and if they're not feeling well and they have arthritis or any kind of strange skin rash, maybe it's something to think about. And the other thing that the patient should understand is that there is a blood test that's helpful in diagnosing lupus, but the test is positive in many other instances. So having a positive test, which we call an anti-nuclear antibody or ANA, having that test doesn't mean you have lupus.
Okay.
It's one of the clues. It can be found in many other situations.
Very good. Well, Dr. Brent, thank you so much for taking the time to share this great information.
Thank you. It's my pleasure.
You're welcome. Be sure to watch more episodes on this topic and other issues of interest to all patients here on the Rheumatology Show. We will see you next time.